Welcome to ASCO Education by the Book, our new monthly podcast series that will feature engaging discussions between editors and authors from the ASCO Educational Book. We'll be bringing you compelling insights on key topics featured in education sessions at ASCO meetings and some deep dives on the approaches shaping modern oncology. I'm Dr. Nate Pennell, the director of the Cleveland Clinic Lung Cancer Medical Oncology Program, as well as vice chair of clinical research for the Towson Cancer Center. Today, I'm delighted to welcome Dr. Chloe Atreya, professor of medicine in the GI Oncology Group at the University of California, San Francisco, Helen Diller Family Comprehensive Cancer Center, and the UCSF Osher Center for Integrative Health, to discuss her article titled Integrative Oncology, Incorporating Evidence-Based Approaches to Patients with GI Cancers, which was recently published in the ASCO Educational Book. Our full disclosures are available in the transcript of this episode. Dr. Atreya, it's great to have you on the podcast today. Thanks for joining me.
Thanks, Dr. Pennell. It's a pleasure to be here.
Dr. Atreya, you co-direct the UCSF Integrative Oncology program with a goal to really help patients with cancer live as well as possible. And before we dive into the review article and guidelines, I'd love to just know a little bit about what inspired you to go into this field.
Yeah, thank you for asking. I've had a longstanding interest in different approaches to medicine from global traditions. And I have a degree in pharmacology, and I continue to work on new drug therapies for patients with colorectal cancer. And one thing that I found is that developing new drugs is a long-term process. And often we're not able to get the drugs to the patients in front of us. And so early on, as a new faculty member at UCSF, I was trying to figure out what can I do for the patient in front of me if those new drug therapies may not be available in their lifetime. And one thing I was recognizing was that in some conversations, the patient and their family members, even if the patient had metastatic disease, they were really able to stay very present and to live well without being sidelined by what might happen in the future. And then in other encounters, people were so afraid of what might be happening in the future, or they may have regrets maybe about not getting that colonoscopy, and that was eroding their ability to live well in the present. So I started asking the patients and family members who were able to stay present, what's your secret? How do you do this? And people would tell me, it's my meditation practice or it's my yoga practice. And so I became interested in this. And an entry point for me and an entry point to the Osher Center at UCSF was that I took the mindfulness-based stress reduction program to try to understand experientially the evidence for this, and became very interested in it. I never thought I would be facilitating meditation for patients, but it became a growing interest. And as people are living longer with cancer and are being diagnosed at younger ages, often with young families, how one lives with cancer is becoming increasingly important.
I've always been very aware that it seemed like the patients that I treated who had the best quality of life during their life with cancer, however that ended up going, were those who were able to sort of compartmentalize it, where when it was time to focus on discussing treatment or their scans, they were, of course, had anxiety and other things that went along with that. But when they weren't in that, they were able to go back to their lives and kind of not think about cancer all the time. Whereas other people sort of adopt that as their identity almost, is that they are living with cancer, and that kind of consumes all of their time in between visits and really impacts how they're able to enjoy the rest of their lives. And so I was really interested when I was reading your paper about how much mindfulness seemed to be sort of like a formal way to help patients achieve that split. I'm really happy that we're able to talk about that.
Yeah, I think that's absolutely right. So each of our patients is more than their cancer diagnosis. And the other thing I would say is that sometimes patients can use the cancer diagnosis to get to what is it that I really care about in life. And that can actually heighten an experience of appreciation for the small things in life, appreciation for the people that they love. And that can have an impact beyond their lifetime.
Just in general, I feel like integrative medicine has come a long way, especially over the last decade or so. So there's now mature data supporting the incorporation of elements of integrative oncology into comprehensive cancer care. We've got collaborations with ASCO. They've published clinical practice guidelines around diet, around exercise, around the use of cannabinoids. ASCO's worked with the Society for Integrative Oncology to address management of pain, anxiety, depression, fatigue, lots of different evidence bases now to try to help guide people, because this is certainly something our patients are incredibly interested in learning about. Can you get our listeners up to speed a little bit on the updated guidelines and resources supporting integrative oncology?
Sure. I can give a summary of some of the key findings. And these are rigorous guidelines that came together by consensus from expert panels. I had the honor of serving on the anxiety and depression panel. So these panels will rate the quality of the evidence available to come up with a strength of recommendation. I think that people are at least superficially aware of the importance of diet and physical activity, and that cannabis and cannabinoids have evidence of benefit for nausea and vomiting. They may not be aware of some of the evidence supporting these other modalities. So for anxiety and depression, mindfulness-based interventions, which include meditation and meditative movement, have the strongest level of evidence. And the clinical practice guidelines indicate that they should be offered to any adult patient during or after treatment who is experiencing symptoms of anxiety or depression. Other modalities that can help with anxiety and depression include yoga and Tai Chi or Qigong. And with the fatigue guidelines, mindfulness-based interventions are also strongly recommended, along with exercise and cognitive behavioral therapy, Tai Chi and Qigong during treatment, yoga after treatment. And some of these recommendations also will depend on where the evidence is. So yoga is an example of an intervention that I think can be helpful during treatment, but most of our evidence is in patients who are post-treatment. So most of our guidelines separate out during treatment and the post-treatment because the quality of evidence may be different for these different phases of treatment. With the pain guidelines, the strongest recommendation is for acupuncture, specifically for people with breast cancer who may be experiencing joint pain related to aromatase inhibitors. However, acupuncture and other therapies, including massage, can be helpful with pain as well. So those are a few of the highlights.
Yeah, I was surprised at the really good level of evidence for the mindfulness-based practices, because I don't think that's the first thing that jumps to mind when I think about integrative oncology. I tend to think more about more of the physical interventions like acupuncture or supplements or whatnot. So I think this is really fantastic that we're highlighting this. And a lot of these interventions like the Qigong, Tai Chi, yoga, is it the physical practice of those that benefits them, or is it it gives them something to focus on to be mindful of? Is that the most important intervention? It doesn't really matter what you're doing as long as you have something that kind of takes you out of your experience and allows you to focus on the moment.
I do think it is a mind, body, and spirit integration so that all aspects are important. We also say that the best practice is the one that you actually practice. So part of the reason that it's important to have these different modalities is that not everybody is going to take up meditation. And there may be people for whom stationary meditation, sitting and meditating works well, and other people for whom meditative movement practices may be what they gravitate to. And so I think that it's important to have a variety of options. And one thing that's distinct from some of our pharmacologic therapies is that the safety of these is quite good. So it becomes less important to say, overall, is Tai Chi better or is yoga better, for instance? It really depends on what it is that someone is going to take up.
And of course, something that's been really nice evidence-based for a long time, even back when I was in my training in the 2000s with Jennifer Pennell at Mass General Hospital, was the impact of physical activity and exercise on patients with cancer. It seems like that is pretty much a universally good recommendation for patients.
Yes, that's absolutely right. Physical activity has been associated with improved survival after a cancer diagnosis, and that's both cancer-specific survival and overall survival. The other thing I'll say about physical activity, especially the mindful movement practices like Tai Chi and Qigong and yoga, is that they induce physiologic shifts in the body that can promote relaxation. So they can dampen that stress response in a physiologic way. And these movement practices are also the best way to reduce cancer associated fatigue.
One of the things that patients are always very curious about when they talk to me, and I never really feel like I'm as well qualified as I'd like to be to advise them, is around dietary changes in nutrition. And can you take me a little bit through some of the evidence base for what works and what doesn't work?
Sure. I do think that it needs to be tailored to the patient's needs. Overall, with a diet that is plant-based and includes whole grains is really important. And I often tell patients to eat the rainbow because all of those different phytochemicals that cause the different colors in our fruits and vegetables are supporting different gut microbiota. So that is a basis for a healthy gut microbiome. That said, if someone is experiencing symptoms related to cancer or cancer therapy, it is important to tailor the dietary approaches. This is where some of the mindful eating practices can help. So sometimes actually not just focusing on what we eat, but how we eat can help with symptoms that are associated with eating. So some of our patients have loss of appetite, and shifting one's relationship to food can help with nutrition. Sometimes slow it down practices can help both with appetite and with digestion.
One of the things that you said both in the paper and just now on our podcast, talking about how individualized and personalized this is, and I really liked the emphasis that you had on flexibility and self-compassion over rigid discipline and prescriptive recommendations here. And this is perhaps one of the real benefits of having an integrative oncology team that can work with patients as opposed to them just trying to find things online.
Yes, particularly during treatment, I think that's really important. And that was borne out by our early studies we called Being Present. So after I was observing the benefits anecdotally among my patients of ability to be present, design these pilot studies to teach meditative practices to patients. And in these pilot studies, the original ones were pretty prescriptive in a way that mindfulness-based stress reduction is fairly prescriptive in terms of like, this is what we're asking you to do, just stick with the program. And there can be benefits if you can stick with the program. It's really hard, though, if someone is going through treatment, and with GI cancers, it may be that they're getting chemotherapy every 2 weeks and they have 1 week where they're feeling really crummy and another week where they're trying to get things done. And we realize that sometimes people were getting overwhelmed and feeling like the mindfulness practice was another thing on their to-do list, and that they were failing if they didn't do this thing that is important for them. And so we've really kind of changed our emphasis. And part of our emphasis now is on incorporating mindfulness practices into daily life. Any activity that doesn't require a lot of executive function can be done mindfully, meaning with full attention. And so, especially for some of our very busy patients, that can be a way of, again, shifting how I'm doing things rather than adding a new thing to do.
And then another part I know that patients are always very curious about that I'm really happy to see that we're starting to build an evidence base for is the use of supplements and natural products. So can you take us a little bit through where we stand in terms of evidence behind, say, cannabis and some of the other available products out there?
Yeah, I would say that is an area that requires a lot more study. It's pretty complicated because, unlike the mindfulness practices where there are few interactions with other treatments, there is the potential for interactions, particularly with the supplements. And the quality of the supplements matters. And then there tends to be a lot of heterogeneity among the studies, both in the patients and what other treatments they may be receiving, as well as the doses of the supplements that they're receiving. One of my earliest mentors at Yale is someone named Dr. Tommy Chang, who has applied the same rigor that we apply to testing of biomedical compounds to traditional Chinese medicine formulas. And so ensuring that the formulation is stable and then formally testing these formulations along with chemotherapy. And we need more funding for that type of research in order to really elevate our knowledge of these natural products. We often will direct patients to the Memorial Sloan Kettering About Herbs database as one accessible source to learn more about the supplements. We also work with our pharmacists who can provide the data that exists, but we do need to take it with a grain of salt because of the heterogeneity in the data. And then it's really important if people are going to take supplements for them to take supplements that are of high quality. And that's something in the article that we list all of the things that one should look for on a label of a supplement to ensure that it is what is billed to be.
So most of what we've been talking about so far has really been applying to all patients with cancer. But you, of course, are a GI medical oncologist, and this is a publication in the educational book from the ASCO GI Symposium. GI cancers obviously have an incredibly high and rising incidence rate among people under 50, representing a quarter of all cancer incidents worldwide, a third of cancer-related deaths worldwide. Is there something specific that GI oncologists and patients with GI cancers can take home from your paper, or is this really apply to pretty much everyone?
Yeah, so the evidence that we review is specifically for GI cancers. So it shows both the strength and also some of the limitations. So many of the studies have focused on other cancers, especially breast cancer in the integrative oncology field. There are definitely gaps in studying GI cancers. At the same time, I would say that GI cancers are very much linked to lifestyle in ways that are complicated and we don't fully understand. However, the best ways that we can protect against development of GI cancers, acknowledging that no one is to blame for developing a GI cancer and no one is fully protected, but the best things that we can do for overall health and to prevent GI cancers are a diet that is plant-based, has whole grains. There's some data about fish that, especially the deep water fish, may be protective, and then engaging in physical activity. One thing I would like for people to take away is that these things that we know that are preventative against developing a cancer are also important after development of a GI cancer. Most of the data comes from studies of patients with colorectal cancer. And that, again, both cancer-specific and overall mortality is improved with better diet and with physical activity. So this is even after a cancer diagnosis. And I also think that, and this is hard to really prove, but we're in a pretty inflammatory environment right now. So the things that we can do to decrease stress, improve sleep, those decrease inflammation in the body. And we do know that inflammation is a risk factor for developing GI cancers. So I think that all of the integrative modalities are important, both for prevention and after diagnosis.
And one of the things you just mentioned is that most of the studies looking at integrative oncology and GI cancers have focused on colorectal cancer, which of course is the most common GI cancer. But you also have pointed out that there are gaps in research and what's going on and what needs to be done in order to kind of broaden some of this experience to other GI cancers.
Yeah, and I will say that there are gaps even for colorectal cancer. So right now, some of the authors on the article are collaborating on a textbook chapter for the Society for Integrative Oncology. And so we're, again, examining the evidence specifically for colorectal cancer. And are in agreement that the level of evidence specific to colorectal cancer is not as high as it is for all patients with adult cancers. And so even colorectal cancer, we need to study more. Just as there are different phases of cancer where treatments may need to be tailored, we also may need to tailor our treatments for different cancer types. And that includes what symptoms the patients are commonly experiencing and how intense the treatment is, and also the duration of treatment. Those are factors that can influence which modalities may be most important or most applicable to a given individual.
So a lot of this sounds fantastic. It sounds like things that a lot of patients would really appreciate working into their care. Your article focused a little bit on some of the logistics of providing this type of care, including group medical visits, multidisciplinary clinics staffed by multiple types of clinicians, including APPs and psychologists, and talked about the sustainability of this in terms of increasing the uptake of guideline-based integrative oncology. Talk a little bit more about both at your institution, I guess, in the overall health system, and how this might be both sustainable and perhaps how we broaden this out to patients outside of places like UCSF.
Yes, that's a major focus of our research efforts. A lot of comprehensive cancer centers and other places that patients are receiving care, people may have access to dietitians, which is really important, nutritionists. In the article, we also provide resources for working with exercise therapists, and those are people who may be working remotely and can help people, for instance, who may be in rural areas. And then our focus with the mind-body practices in particular has been on group medical visits. And this grew out of, again, my being present pilot studies where we were showing some benefit, but then when the grant ends, there isn't a way to continue to deliver this care. And so we were asking ourselves, is there a way to make this sustainable? And group medical visits have been used in other settings, and they've been working really well at our institution, and other institutions are now taking them up as well. And this is a way that, in this case, it's me and many of my colleagues who are delivering these, where I can see 8 or 10 patients at once. In my case, it's a series of 4 2-hour sessions delivered by telehealth. So we're able to focus on the integrative practices in a way that's experiential. So in the clinic, I may be able to mention, after we go over the CT scans, after we go over the labs and the molecular profiling, may be able to say, hey, meditation may be helpful for your anxiety. But in the group medical visits, we can actually practice meditation. We can practice chair yoga. And that's where people have that experience in their bodies of these different modalities. And the feedback that we're receiving is that sticks much more. To experience it, then you have resources to continue it. And then the group is helpful both in terms of delivery, so timely and efficient care for patients. It's also building community and reducing the social isolation that many of our patients undergoing treatment for cancer experience.
I think that makes perfect sense. And I'm glad you brought up telehealth as an option. So obviously I don't know how many trained integrative oncologists there are out there, but I'm going to guess this is not a huge number out there. And much like other specialties that really can improve patients' quality of life, like palliative medicine, for example, not everyone has access to a trained expert in their cancer center. And things like telemedicine and telehealth can really potentially broaden that. How do you think telehealth could help broaden the exposure of cancer patients and even practitioners of oncology to integrative medicine?
Yes, I think that telehealth is crucial for all patients with cancer to be able to receive comprehensive cancer care, no matter where they're receiving their chemotherapy or other cancer-directed treatments. So we will routinely be including patients who live outside of San Francisco. Most of our patients live outside of San Francisco. There's no way that they could participate if they had to drive into the city again to access this. And in the group setting, it's not even safe for people who are receiving chemotherapy to meet in a group at most times. And with symptoms, often people aren't feeling so well, and they're able to join us on Zoom in a way that they wouldn't be able to make the visit if it was in person. And so this has really allowed us to expand our catchment area and to include patients, in our case, in all of California. You also mentioned training, and that's also important. So as someone who's involved in the OSHER Collaborative, there are faculty scholars who are at universities all over the US. So I've been able to start training some of those physicians to deliver group medical visits at their sites as well via telehealth.
Well, good. I'm glad we were able to make a plug for that. We need our political leadership to continue to support reimbursement for telehealth because it really does bring access to so many important elements of healthcare to patients who really struggle to travel to tertiary care centers, and their local cancer center can be quite a distance away. So sticking to the theme of training, so clinician education and resources are really crucial to continue to support the uptake of integrative oncology in comprehensive cancer care. Where do you think things stand today in terms of clinician education and professional development in integrative oncology?
It's growing. Our medical students now are receiving training in integrative medicine, and making a plug for the education book. I was really happy that ASCO let us have a table that's full of hyperlinks. So that's not typical an article. Usually you have to go to the reference list, but I really wanted to make it practical and accessible to people. Both the resources that can be shared with patients that are curated and selected that we thought were of high quality examples for patients. At the bottom of that table also are training resources for clinicians. And some of those include the Center for Mind-Body Medicine, where people can receive training in how to teach these mind-body practices, the Integrated Center for Group Medical Visits, where people can learn how to develop their own group medical visits. Of course, there's the Society for Integrative Oncology. And then I had just mentioned the OSHER Collaborative Faculty Fellowship.
Oh, that is fantastic. And just looking through, I mean, this article is really a fantastic resource, both of the evidence base behind all of the elements that we've discussed today. Actually, the table that you mentioned with all of the direct hyperlinks to the resources is fantastic. Even recommendations for specific dietary changes after GI cancer diagnosis. So highly recommend everyone read the full paper after they have listened to the podcast today. Before we wrap up, is there anything that we didn't get a chance to discuss that you wanted to make sure our listeners are aware of?
One thing that I did want to bring up is the disparities that exist in access to high quality symptom management care. So patients who are racial and ethnic minorities, particularly our Black and Latinx patients, the evidence shows that they aren't receiving the same degree of symptom management care as non-Hispanic white patients. And that is part of what may be leading to some of the disparities in cancer outcomes. So if symptoms are poorly managed, it's harder for patients to stay with the treatment. And integrative oncology is one way to try to, and especially with telehealth, this is a way to try to improve symptom management for all of our patients to help improve both their quality of life and their cancer outcomes.
Well, Dr. Atreya, it's been great speaking with you today. And thank you for joining me on the ASCO Education by the Book podcast. And thank you for all of your work in advancing integrative oncology for GI cancers and beyond.
Thank you, Dr. Pennell. It's been a pleasure speaking with you.
And thank you to all of our listeners who joined us today. You'll find a link to the article discussed today in the transcript of the episode. We hope you'll join us again for more insightful views on topics you'll be hearing at the education sessions from ASCO meetings throughout the year and our deep dives on approaches that are shaping modern oncology.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.